Hospice services and acute medical services they're similar, but there are certain significant differences. The team model is a model of care that really was developed by the hospice industry many years ago, and has now fortunately been taken out to other parts of healthcare. It really is a very important feature for patients and families, because we have come to understand that all the problems that people have at end of life are interrelated.
The interdisciplinary team is so important to care for our patients, and really it's become the icon of how we should deliver medical care in every specialty, right? So we have the 4 core players, right? We have the physician, the nurse, the social worker, and the chaplain. So, what the interdisciplinary team is trying to do is to help to relieve suffering on all those different levels.
I'm an expert in what I do, but then I rely on the expertise of other people on my team. The psychosocial social worker, the chaplain, the nurse, the home health aide. These are individuals who are expert in what they do, and I rely on them to share with me what they can bring to the table. And together, I think that really allows us to care for a person as a whole being. And that whole being not only includes the patient, but also the family. So that's an extension of that patient. And so I think that's kind of the key thing that makes hospice very unique, that whole person approach, that interdisciplinary approach of trying to care for somebody.
Hospice is not looking at disease as much as it is looking at the patient's comfort, the patient's emotional status, the patient's social status, what the family needs, and all of a sudden they feel peace. I think that that's what VITAS Hospice specifically, brings to the table, is expanding the patient's sense of getting their lives back, getting control of their lives, and maybe also having some real input on the last few months of their lives as to where they're going to be going in this journey of life.